All right, welcome to week 3, module 3. Let me share my screen. All right, so module 3 in Giddens, we will provide a quick synthesis of every chapter. The concepts are spirituality, stress, coping, mood, affect, anxiety, and cognition. These are the learning objectives that you will be exposed to this week. In simulation this week. All right, so the first concept is spirituality, and NCLEX added this concept in 2016 because it's so important in a lot of our clients' lives. So spirituality, internalized spiritual identity, which can be God, Jesus, Muhammad, the Buddha, ultimate truth of reality, and spirituality is universal. Illness impacts spirituality. The patient and or their family must be willing to share and act on their spiritual beliefs. Spiritual beliefs are practices impacted by family and culture. You as a nurse must be willing to assess and integrate patients' beliefs into their care. Nurses must be willing to consult with appropriate spiritual experts such as the chaplain. That's important as well. A community-based religious organization can also provide support and resources for our patients. We're going to be talking about the FICA tool, which is a spiritual assessment in lab this week. You're going to practice the FICA tool assessment on either another nursing student, so that way you can better understand it. And this is where it will ask you spiritual beliefs and how it might impact your hospital care. So FICA is an acronym for faith or beliefs, importance, and influence, community, and how you're going to address those. The nursing interventions involve communication, actions, such as giving verbal support and encouragement of spiritual beliefs, making a referral, as I said before, to a pastoral care professional or a chaplain, using religious literature that's meaningful to the client and or their families, using prayer with the client's or family's consent, and then the most important is presence, the presence with your client and their family members. Okay, here's the question on spirituality. Please answer this in a Word doc that was provided. And then we have the concept of stress. This concept of stress is defined as an internal or external event or demand of life experienced by the individual that's perceived and appraised for scope and meaning on a continuum to determine whether resources and abilities for management are available, exceeded, or exhausted. Remember the fight or flight response that increases the heart rate, the blood pressure, increases perfusion to the skeletal muscles, increases bronchial dilation, pupil dilation, increases glucose, which is an initial response of the release of epinephrine that triggers the fight or flight response. But we know that sustained stress increases the release of cortisol, and this increases the risk of hypertension, cardiovascular disease, diabetes due to the increased glucose in our blood, immunosuppression, and the anti-inflammatory response, and also increase protein synthesis. Physiological structures also are acute chronic pain, cancer, diabetes, traumatic injuries, Psychological stresses such as childbirth, caregiving, change in health status, death of a spouse, a friend, or a significant other, a marriage, environmental incidents that might happen, such as a tornado or a hurricane, and other incidents that have been happening, which has caused environmental stress on people. Spiritual distress, chronic stress can affect the cardiovascular status, the neurovascular status, such as memory loss, the immune status, making them more prone to disease and infections, musculoskeletal status, GI, skin disorders, sexuality, reproductive system, GI problems. Women, young adults with children, and low income are all at increased risk. The social worker is a person to refer for community resources and short-term counseling. We as nurses can help with relaxation measures. We can encourage exercise, meditation, deep breathing. We can train therapeutic touch massage, health education, and smoking cessation. And sometimes short-term anti-anxiety drugs can be prescribed for acute stress. Primary prevention is having a positive attitude, exercising daily, eating healthy, sleeping well, and then secondary prevention measures entail screening for stressors. All right, so then we'll move on to concept of stress, question 2. So make sure you answer this in the Word document that was provided and submit it as your lab ticket. All right, so now next is the concept of coping. Definition is it's a cognitive means and behavioral actions to manage internal and external situations perceived as difficult or beyond an individual's current resources. Begins with a cognitive evaluation of the situation. The first involves primary appraisal or the initial evaluation to understand the situation. The individual evaluates the potential for self-harm to their self or a loved one's well-being, self-esteem, or personal values, and may determine how much personal control can be exercised over their situation. The second phase of cognitive assessment is a secondary appraisal. Here, the individual evaluates the resources available to overcome, eliminate, or reduce the stressor and determine to what extent the problem is controllable. The second process, which follows the cognitive assessment, refers to how the problem is addressed or how the individual engage with the problem. In other words, the primary and secondary appraisal drive the action an individual takes and attempts to cope with their stressor. After an individual takes the action, a reappraisal process is done. Problem-focused coping involves the cognitive process of evaluating the situation and then taking an action to manage or change a situation or circumstance associated with the stressor. The focus is usually geared toward eliminating or reducing the underlying cause of the stressor. Emotion-focused coping emphasizes the regulation of the emotional response that occurs in a given situation. No attempt is made to address the situation or stressor. Rather, the focus is on controlling the emotional response as a result of the situation. Meaning-focused coping involves process whereby the individual draws on values, beliefs, and goals to modify the personal interpretation and response to a problem. Problem-focused is the most accessible, the most successful. Children, older adults, and adolescents are collaborative interventions are problem-focused. Coping strategies are most commonly applied when stressors can be modified, changed, or controlled. Emotion-focused coping strategies address the feelings as a result of the stressor. These strategies do not work towards a solution to their problem, but they can help create a well-being such as physical activity. Meaning-focused coping strategies address an individual's personal values, beliefs, or goals in assumption is a way to modify the personal interpretation and response to the stressors such as changing goals. And next, we're going to talk about the question 3 that you have to answer. Then we're going to talk about the concept of mood and affect. This concept refers to how a person feels, and the term affect is defined as the observable response a person has to his or her feelings. The term euthymia, here, let me see here. Euthymia is used to describe normal health fluctuations in mood. There are mood spectrum disorders which disrupt the individual's ability to function normally, and individuals with mood spectrum disorders are at increased risk for many problems, such as health status impairment, addiction, and potential for violence. Mood spectrum disorders must be diagnosed by the physicians or other qualified advanced practitioners trained in making medical psychiatric diagnostics or diagnoses. You will discuss various mood disorders in concepts 3. This is just an introduction to these concepts, which focus on depression and anxiety. Signs of affective instability, such as crying, rage, euphoria, and blunting, indicate that there is a need for a further assessment because such individuals may have a mood disorder. Functional status, such as ADLs and IADLs. Remember, we have some powerful neurotransmitters like dopamine, norepinephrine, serotonin. They have a powerful role in regulating our appetite, sleep, thought, emotions, mood, learning, memory, motivation, and concentration. Excessive or insufficient levels of neurotransmitters are associated with mood disorders and other mental health conditions. Every RN is expected to be able to complete a mini mental assessment exam, depression and anxiety assessment. And you will do this in lab next week. Well, no, this week, I'm sorry. Healthcare practitioners are needed for prescriptions for antidepressants, anti-anxiety drugs, or mood stabilizers. And MSWs are helpful, or a psychologist or psychotherapy will help. Here's the question that you should answer for on your Word document. So next we have the concept of anxiety, and anxiety is defined as a subjectively distrustful experience activated by the perception of threat. Has both a potential of psychological and physiological symptoms. Etiology can be mild, moderate, or severe. 4 levels with specific signs and symptoms. Mild is the fight or flight. Moderate includes restlessness and muscular tension with decreased alertness and concentration. Severe anxiety impairs cognition and attention with physical and emotional symptoms and the inability to concentrate. And finally, panic, inability to function, such as freezing, misperception of the environment, emotional and behavioral misregulation. There's critical structures with the limbic system, such as the thalamus, hypothalamus, the hippocampus, and they all appear to play a central role in anxiety. Likewise, those critical neurotransmitters and hormones, such as serotonin or epinephrine, GABA, dopamine, and the thyroid hormone, are also central to anxiety. So be sure to look at other anxiety affects. Our clients with panic and compulsion as being the severe symptoms of anxiety. What else should you guys look for? With chronic anxiety, such as cancer, asthma, and heart disease, diabetes, irritable bowel syndrome, and other chronic infections. In simulation this week, you're going to perform anxiety assessments. More discussion with obsessive compulsive disorders will be in concepts 3. So here's the next question. And our last concept is on cognition. All right, there's 6 domains of cognitive function um, that you'll be referring to: types of memory. Let's see, let me check my notes here. All right, so cognition is defined as the mental action or process of acquiring knowledge and understanding through thought, experience, and the senses. 6 domains of cognitive function include perceptual, motor function, language, learning and memory, social cognition, complex attention, and executive function. Perception is the interpretation of the environment and is dependent on the acuity of sensory input. Memory broadly refers to the retention and recall of past experiences in learning. Executive function refers to the higher thinking process that allow for flexibility, adaptability, and goal directedness. Executive function determines the contents of consciousness, supervises voluntary activity, and is future oriented. Types of memory depends on the anatomic location in the brain. Declarative, episodic, and semantic memory, immediate memory, working memory, and procedural memory. Remember, optimal brain function depends on perfusion and oxygenation, glucose supply, and electrolyte balance. So more detail on cognition will be discussed in Concepts 3, which is the next course, 138. We will also talk about delirium here. Delirium can be caused by dehydration, drugs, lack of oxygen, fever, and disease processes. Dementia can be determined by a MMSE, but cannot be caused by diseases such as Parkinson's diagnosis, traumatic brain injury, and brain attacks. Cognitive disorders can be caused by intellectual disabilities and learning disabilities. We'll talk about this in lab once we do our cognitive assessment tools. All RNs are expected to complete a MMSE. You will do this in simulation this week. Remember, occupational therapists, speech therapists, healthcare providers, a social worker, physical therapist, and a registered nurse are all involved. All right, that sums it for this week. Thank you.